Good morning, everyone. Today we are going to discuss the topic of peripheral neuropathy. Now, peripheral neuropathy is a condition where you have numbness, tingling of the hands and feet. And this kind of condition usually shows up chronic. That means that even you had it for many years or many months, and you may have tried almost every single treatment, medications from your medical doctor. You may have tried physical therapy, ultrasound, stimulation, exercising, traction of the neck or the back, didn't work. You may have tried injection, having cortisone shot or epidural shot into your spine, into your hands, into your feet. It doesn't work. Acupuncture, maybe you feel better for a day or two. Chiropractic, just your spine, it doesn't work. Everything you try, maybe some of them feel better for a day or two, but eventually all came back. You try massage every single day, temporary relief, but there is not a permanent solution. And a lot of patients, when they come to me, they have lost hope because they have been to everybody and they are very skeptical, saying, oh, it's just another program you're offering. But no, there is hope. Today, I will discuss with you what is peripheral neuropathy, what different kind of testing there is available, what other doctors do not know, other testing procedure that other doctors do not have the access to or do not have the knowledge to help you find out the foundation, the base, the core cause of the peripheral neuropathy, tingling and numbness of the foot. And I will also show you different treatment protocol, entire program where other doctors have no sources of, they have no access to. And this entire program that we offer is entirely different from what you have ever seen before. So stay with me, okay? So let me read off the definition of peripheral neuropathy for you. And peripheral neuropathy, if you can read with me, describes damage to the peripheral nerves, which is the nerve on the hands and feet, a vast communication network that transmits information from the brain, spinal cord to every other part of the body. So basically, their sensation motor transmission comes from the brain, go to all the nerve system of the body. So there is a relationship of the brain and the spine and other parts of the body. And peripheral nerve also sends sensory information back to the brain and spinal cord, such as a message that the foot are cold or a finger is burned. Damage to the peripheral nervous system interferes with those vital connections. Okay, kind of like a static telephone lines. Peripheral neuropathies distort and sometimes interrupt messages between the brain and the rest of the body. Okay, so distortion of the telephone line that exactly describes sensation of numbness, tingling of the foot. And that's almost every single patient that walk in the door have that kind of distortion. Either burning, cold feet, cold hands, burning hand, burning feet, tingling numbness in the hand and feet, losing strength, and losing muscle mass. These are very, very common symptoms. And there are three types of nerve damage. There's sensory, there's motor, and there is anatomic. The sensory is, which I just described, burning sensation, tingling sensation. You're very sensitive to touch. Whenever you touch metal, you feel a shock. Okay. The diabetes is one of the major causes of the sensory neuropathy, sensory damage to the hands and feet, diabetes. And motor means that when you have this kind of condition, you're unable to control your hands and feet. You have a lot of muscle twitches, muscle spasming. You are cramping all the time. You seem to be losing the control of your limbs. Even the worst is paralysis of the limbs. Okay, anatomic nervous system damage. The autonomic nervous system, it controls the blood pressure, controls the internal organs. So if anything wrong, whenever you have this kind of nerve disconnection of the brain to the spinal cord to your arms and leg, Whenever you have this kind of conditions, a lot of time patient will have, other than numbness, tingling of the feet, they will have stomach bloating, they have blurry vision, constipation, and they have decreased, if access sweating, they have diarrhea, difficulty urinating, they feel dizzy all the time, and they're cannot control their pee, they got to go to the restroom all the time, and they have, for male, impotence and difficulty breathing, and all these organal disruption. And people thought it's their organ issue, it's their actual stomach issue, but actually it's not. It is their nerve that's been disrupted somewhere in the brain or spinal cord, somewhere in the nerve. If we do not fix that nerve, all these internal organ issues will not be taken care of. If you go to a medical doctor, you take medication, it's not going to help. The symptom is going to come and come and come, continue to come. Okay? That's why we got to find out the real cause of all your symptoms. And people that with numbness, tingling, almost every one of them have all other issues, all other systemic issues. It's very, very common that I see that. Okay, so there's a lot of different causes to peripheral neuropathy, a lot. One of the primary causes, like I said, is a spinal issue. All right, so let's look at the dermatomes. If you have a tingling sensation, let's look at the hands here. On the right, if you have tingling sensation on these three fingers, then according to the term dermatomes, you have a C6 disruption on the neck area. If you have these two numbness, tingling on these two fingers, then we know it's C8. If you have a middle finger that's more numb, more pain than all the other finger, then for sure we know it's C7. Okay, so this is called dermatome pattern. So we can find out exactly what nerve affects which part of the skin. Okay, and a lot of patients when they come in, they have numbness, tingling at the sole of the foot. And the sole of the foot is either L4 or L5. Okay, and also a lot of time they have on the side of the calves, and that's primarily S1. S1 nerve is the nerve that is close to the anus. Okay, the sacrum area here. All right, so that's how we determined if your numbness, tingling is coming from the back or not. And a lot of time, over 90%, I wouldn't say 90, probably 80-90% of the cases that patient with peripheral neuropathy, numbness, tingling the foot, most of them have an association of their spinal pain or spinal discomfort or some kind of spinal damage, whereas we have to fix the spine as well as their foot and hands. Okay, so brains. Yes, like we just described in the previous paragraph, that the numbness, tingling of the hands has a lot to do with the brain, either coming from the cerebellum, the cortex, the medulla, the thalamus. There is a pathway we call lower diameter afferent pathway. Now this pathway is like a freeway. If you want to go from Alhambra to Rosemead, Alhambra to West Covina, you got to take a freeway to get there to be much faster, right? To get there faster. Now, lower diameter afferent pathway, it's like a freeway. It helps you transmit information from one station to another, from one neuron to another, from one location of the brain to location of the hands. Okay, that's a pathway has to be clear. So a lot of times the pathway is blocked by something. That's the reason why the numbness, tingling, and that's why if we went to a lot of doctors. You numb hand, they fix the hand, doesn't work because the brain is not being fixed, the spine is not being fixed. Okay, so we gotta look at the brain, and also we have to look at whenever you have a brain issue, we gotta look at different brain waves, and there's a brain wave, the delta, alpha, theta, beta, SMR, mu, and gamma. All this wave has to be looked at it, and there is a way to test this, which I will show you. How to determine if your numbness, tingling of the hands and feet are coming from the brain here. Okay. There's also the issue of neurotransmitter, where the signal of the brain from one cell to another, the signal has been blocked. There's dopamine, there's serotonin, there's GABA, there's acetylcholine, there's epinephrine, there's melatonin, all these signal which transmit messages from one neuron to another, and also send signal down to the hands and feet. This signal has to be flowing. If there's something blocking the signal, there's a lot of reason why the signal could be blocked. Then for sure, we gotta look at the neurotransmitters. There's also issue with the inflammation. Now, when neurotransmitter is blocked, when nerve is blocked, most likely one of the major chemical effect that affects the flow of the nerve is inflammation. Okay, so patient come to my clinic almost all the time. The primary issue, the very first priority that causes the nerve disruption is inflammation. Okay, and where does it come from? Everybody asks me that question. Where does it come from? Inflammation comes from mostly diet. Mostly. There are other causes, but most of the time it's diet. Okay, so sugar is one of the primary issue that causes the inflammation. It's a primary issue. Nightshade vegetables such as, it says here, potatoes, starches, and there's yellow, orange, jalapeno, chilies, cayenne pepper, tomatoes, eggplant, paprika. All these food are nightshade, and these nightshade vegetables cause severe inflammation reaction to your nerve system. So I would tell patients you have to avoid these food at all costs if you want to get better. All right, this is a major inflammation. Most important information that patients have to know, and this is the most important information that other doctors do not know. They will not tell you about the food restriction. They just tell you, they just give you medication, they give you injection. There is no use. The pain just come back. The tingling numbness has come back. Yeah, you can read this for yourself. You can pause and read this whole thing for yourself. Okay. So sugar is a major issue that affects the nerve. If you go to YouTube, look at how sugar affects your blood. Okay. Let me go through briefly. If you let's say if you are healthy, you have no sugar, right? No sugar issue. You haven't taken sugar for a whole month. You do your blood. You put one drop of blood into a microscope. You'll see your blood clean as a whistle. Beautiful, round individuals. But if you go out, have a huge glass of Coca-Cola, one piece of cake, a banana, a fruit tart, a bunch of chocolate, and we do the blood again, you are going to see that all the blood within your blood cell is going to clump up, and there will be no flow of your blood. You'll see it. You'll see on this video. What does that mean? That means the sugar, they will decrease your blood flow. So they will decrease the oxygen exchange, the nutrient exchange of your blood. Okay, so have to avoid sugar. Okay, food allergy. Again, allergy of the food. If your body is weak, if your body's immune system it's weak, your body cannot tolerate the outside food such as soy, dairy, wheat product, corn, and these food will also cause allergic reaction. When you have an allergic reaction to these kind of food, the inflammation just come up. So how do we know? The best way is blood test. Blood test to see if you have allergic reaction to soy, to dairy, to wheat, to corn. And this 4 major food groups is a foundation of the diet in American health, American diet. Yet these 4 groups are just so heavily engineered. Okay, genetically engineered. It's not kidding. Genetically modified food will cause a lot of harm to the body. Will also cause a lot of harm to our brain, to our spinal cord, to our nervous system. Long-term intake of these foods is going to cause serious health issue to our body. Okay, so think about this. And what is wheat? Wheat is, let me describe wheat. It's noodles, pastas, bread. That's wheat. Okay. The next major cause of nerve issue is toxicity. One of the major side effects is statin medication. Almost everybody over the age of 50 that comes in the door are taking some kind of medication, statin medication, because why? The cholesterols are high. And the doctor said, oh, I got to give you a certain supplement, a certain medication to lower your cholesterol. But have you looked at the side effects of the statin medication? Okay, the most common one I've seen are vasostatin. And there's tons of other statin medication, different names. And these statin medication, major side effect is damage to the muscle, the nerve, with pain, with numbness, tingling sensation. This is the major, the most serious side effect of the medication with statin side effect of the body with the statin medication. Okay, so you gotta look at. Remember, if you want any kind of treatment, if you want to get better, you gotta look at your medication. Is there any side effect of the medication that may have caused muscle, tendon, ligament, nerve issue? If you do, no matter what kind of treatment you are getting, you're not going to get better. Gotta know this. It's very important. There's also a chemical issue with respect to, let's say, preservatives, let's say fragrance, pesticide from the vegetables. There's MSG. If you go to a restaurant, MSG is a high neurotoxin. If you eat at a restaurant every day, if not every day, 3 times a week, that's enough to damage your nerve long term. Not only the nerve in your peripheral, also the nerve in your brain, your spinal cord. So do not eat at a restaurant if you are going to get better. Do not eat at a restaurant. Okay. There's also other toxins such as heavy metal, mercuries, which you can find in your teeth. Mercury you can find in canned food, aluminum in canned food, arsenic you can find out in the apple juice, grape juice on the shelf. With the juice, we'll put it there. You can put there for about 2 years. Think about if you can put something there for 2 years, how much of a preservatives are there in that bottle of juice? Think about that. Okay, there's highly number of arsenic in those juices. There's environmental toxin from the pollution, from the air, just tons and tons of toxin. We're living in a toxic soup. So we've got to find a way to detox our body if you want to get better, if you want your nerve to get better. Okay. This is just a research that shows the statin medication, how statin medication causes the damage to the nerve. Okay, so I want you to pause this screen and just go ahead and read this. Okay, so the highlighted word here, exposure to the statin may substantially increase the risk of polyneuropathy. Okay, and this is a magazine, it's a neurology magazine, 2002, May 14. Okay. One of the major issues that causes neuropathy, like I said, is diabetes. If you have high level of blood glucose, high level of sugar in your blood, you're going to have diabetes. The nerve of your feet and hands is going to get damaged, like I mentioned before. Okay? So in order for us to help you with, if you have diabetes, one of the major things for us is to help you control the sugar level. Once the sugar level is down, your diabetes in itself is going to go away by itself without us ever have to treat that. Once you completely take away the sugar from your diet, and once the sugar is gone, you're going to see your hands and feet is going to feel better and better and better. Okay, oxygen deficit. Also, if you're lacking oxygen in your blood, what carry oxygen? Red blood cell. If your red blood cell is so clumped together due to sugar, due to toxin, your ability to carry oxygen is not going to be there. Therefore, your nerve is not going to get the nutrient, no oxygen, no nutrient. How do you expect the nerve to heal? You cannot. Okay. We also have to look at the hormones, the entire hormone system. If the hormone is off balance, it will also cause numbness, tingling in the foot. Okay, it's all here. So read it yourself. So how do we know? One of the best way to know if you have issue with the hormone is blood test. You can test the blood for your testosterone, your estrogen, your progesterone, your LH, your FSH, testosterone total, and androgen as well too. All these can be tested. If you have any issue with the hormone, you have to deal with the hormone issue. That's also another layer to cause the issue, to cause a problem with the nerve as well too. Okay. Now it's a big issue. Another huge issue that I see so much nowadays for patients is autoimmune. Autoimmune such as, no, let's say what is autoimmune? Autoimmune means that your body's immune system is attacking your own nerve. Your body's immune system is attacking your own thyroid, your liver, your kidney, your muscle, your bone, your brain. That's autoimmune. And there's lots and lots more autoimmune nowadays that I see more and more and more with patients that comes in the door. That's the reason why the patient cases become much more complicated. That's the reason why much more doctor cannot solve the problems. It's one of the major issues is autoimmune. And we got to find out patient autoimmune. We got to find out if you have autoimmune or not. If you do not, if you have autoimmune, no matter what we do, you're not going to get better as well. Okay, so we test for in your blood. We test for red blood cell, white blood cell, basophil, eosinophil, neutrophil, phagocyte, monocyte, mast cell, leukocyte, TAP lymphocyte, natural killer cell, cytokinin, and that's interleukin 1-12, and histamine, T helper cell. We also look at IgG, IgA, and IgE, IgA, and IgD. Okay, all these immune system problems. If there is a single issue that shows positive on any of these, you have to solve it. You have to find a way to solve this, or else your nerve system is not going to get repaired, because your body is going to keep on attacking your nerve continuously. Okay, when you have autoimmune issue, your body is going to produce more bacteria, more virus, and more candidas or molds and parasite, and these in turn will start attacking you. If you do not take care of these, if you do not take care of the immune system, these outside external bacteria, virus, mold is going to start attacking your nerve system even more furious. Okay, so all these can be done by blood tests. All these can be done by blood tests. Okay. These are done by stool tests. It's called Metametrics 2105. Okay, if anybody wanted to know. Now, pH balance, which affects the entire body, also the nerve as well too. So we gotta take care of that as well too. Okay, nutritional deficiency. If your nerve does not have enough nutrient that comes from your blood, that comes from your diet, it's not going to heal. It's not going to heal. The most common nutrient missing from the body is minerals, trace minerals, amino acids, vitamin B1, B6, B12, earth metal, essential fatty acid. These has to be, we gotta take these. If you do not get this from your food, we gotta take them in a supplement form. These are essential to the nerve to heal. Okay. There's external stress. The stress from work, stress from home, stress from marriage, stress from money issue, stress from your own personal health. All these internal issues will also affect the nerve heal. And we have patients like that who's constantly stressed about his own health. And every time when he's overstressed, he has numbness, tingling going down. And when he come back in, we manage his stress through some kind of therapy, counseling, and he gets better. The numbness goes away. Okay, so we've got to look at the internal issue, and these stresses comes from the internal issue, the organs. So, for example, kidney affects the fear, liver affects anger. So, or you can reverse it. If you have a lot of anger, it affects your liver. If you have a lot of fear, it affects your kidney. If you have a lot of worries and sadness, it affects our lung. Okay. If you have a feeling of lost, feeling of you have no direction, it affects your small intestine, large intestine. Okay. Body is like a network. It never one way. Never one affects the other. It's always everything affects everything. Okay. So that's why it's so complicated to treat even one single case. One person with peripheral neuropathy, the cause is totally different from another person with a peripheral neuropathy. And every time person come in, we have to look at the entire system, entire thing, entire item we talked about. Maybe this person, the major issue is toxin that caused nerve problem. But this person's major issue is sugar. And this person's major issue is stress emotion. And this person's major issue, it could be just a bad diet. And this person's major issue could be just the side effect of the statin medication. So every time patient comes in, we got to spend time, a lot of time, to kind of explain them to them, and examine them, to find out what exactly is causing problem. Then we give the appropriate treatment for them. We never ever just give them treatment without finding the right cause. Never. Okay. And also, there's a circulation issue, lymphatic issue. If your circulation is bad, like we talk about, if your lymphatic system is not moving, then for sure also your nerve is not gonna get healed. Okay, so lymphatic system, almost nobody knows what lymphatic system is. Lymphatic system work very similar to the blood circulation system, except the lymphatic system of carrying fluids. It clears body of the dirty fluids. If the body fluid is not moving, it's just like a dead palm with dead fishes and smelly palm and dark palm because it's not moving. Okay, so movement of the lymphatic system is very important. A lot of times when patients have cancer, the very first place that the cancer appears is always at the lymphatic system. Most of the time it's always at the lymphatic system. And especially for those very scary, I would say scary, cancer where they move very fast. And that's because the cancer cell have gone into the lymphatic system and carries it all over the body. Okay. There's scar, there's adhesion. Scar and if you have a cut in the skin, a huge scar, let's say a C-section. You had a C-section here. It's been cut here in the stomach. Now our skin works like a computer motherboard. It's transmitting electric charges from head to toe, back and forth, left and right, continuously transmitting messages. Imagine if there is a cut in the motherboard. What about the computer? The computer will stop working. Why? Because there is no electronic charges. So there's no electronic messages transmitting one to another. So if you had a scar, surgical scar here, there will be no transmitting of the messages from top to down. And without the proper transmitting messages, your nerve is going to suffer, your brain is going to suffer, your organ is going to suffer. And that's what scar and adhesion is about. Okay, they're going to take care of that as well. Another way that we examine patient and find out the cause is through a traditional Chinese medicine pulsing, where we pulse the wrist to see what's going on with the body system, to see what's going on with the nerve, with the muscle, with the organs. And by doing the pulse, you can tell us whether the nerve is hot, the nerve is cold, the nerve has wind or damp. I mean, this is just a traditional terminology of the traditional Chinese medicine. And if the fluid has retention of the body, if the blood is clotting up, all this can be done by pulsing. And that's one of the ways that we help patients to assess their body function, other than blood tests, other than MRI and other testing, which I will discuss later. Okay. Another major issue that has numbness and tingling of the foot is cancer. If you have cancer growing in your spine, in your neck or in your back, it's going to cause severe compression of the nerve. Unless you get MRI done, there's no way we can find out. Okay, that's the reason why patients have to go through MRI every single patient that with a major peripheral neuropathy issue. MRI is a must. Okay, so I just talk about all these causes. I'm not saying that everybody have this every cause. No. So like I said, every patient when they come in, I have to do a detailed examination. I look at patient as an onion. An onion with layers, rings and rings and rings of issues. If you look at this, if we take out one ring, there's another ring. When we take out another ring, there's another ring. Each ring represents each different condition, each different cause. So the first ring may be inflammation. Second ring may be a sugar issue. Third ring may be your diet. The fourth ring may be a statin medication side effect. Fifth ring may be a toxicity. The sixth ring may be, your blood circulation is not moving. Your lymphatic system is drained. It's clogged up. Okay, so each ring, if we found out each ring, we take them out. We treat them. Okay, if we inflammation, we treat inflammation. Nerve disruption with toxicity, we treat that. Okay, if there's a issue with the spine that causes nerve compression, we take care of the spine, and that's one layer out. So each person that comes in always has multiple layers. On average, it's about 20 to 30 different layers that we gotta take it away. That's the reason why the treatment time on average for patient is about 2 months to 6 months. Everybody's different, it's hard to say, about 2 to 6 months on average. Okay, let's talk about examination. Examination that we require for patient mostly are nerve conduction velocity, and patient that has severe nerve issue, most of them when they come in, they already have a nerve conduction velocity. Okay, so you get that done in a medical facility, refer them to a hospital or a specialized clinic where you assess which nerve is causing the numbness tingling, whether the hands and the foot. Okay? We also do MRIs, because when we get MRI done, we'll see if the nerve is caused by the spine or the nerve, if there's a herniation, if there's a tear in the spine, in the herniated disc. If there is an issue with the herniation, with the nerve being compressed by the nerve at the neck or the nerve at the back, then we gotta treat that. Okay, we're going to look at the X-ray. The bone shifted or not? Is the bone aligned right or not? Pulse ox is the level of oxygen in your blood. That's very important to check that. Okay, brain scan. We just talked about brain. So we always test the entire brain. Now the entire brain there's a lot of different points. There's total 19 different points that we assess with the brain. We call it brain scan. Okay, so you come in, you sit there in front of the computer, you put on the cap, and the computer is going to analyze every single point on the brain, and it's going to analyze whether you have issue with delta, alpha, theta, beta, gamma, mu, and all the other issue. If you have issue, it's going to give you a graph with different coloration, different results, and we'll discuss with you if your brain is damaged, if your nerve, your tingling and numbness at the foot has an association with the brain or not. We're going to discuss that with you. We're also going to do a complete neurological exam. This exam involves in, first of all, vibration. So we're going to take a vibration of, we're going to do a vibration of the shoulder and the thumb to see if the sensation is same or not. Okay, we're going to compare both thumb to see if sensation is different or same. We're going to do a comparison of the hip in regard to your toe, sensation different or not. Okay, we're going to compare two different toes, sensation different or not. Okay, a lot of patients when they come in, they do not know. They do not realize that they cannot feel with their hand. They cannot feel with their toe. They do not realize that unless we do the testing. And also we're testing the positioning sense of the foot. of the nails, of the toe, to see whether you feel that I am actually moving the toes, to make you feel, eyes closed, move your finger. Am I actually moving that finger? You can actually feel it. If you're numb, if your nerve is dead, you cannot feel it. Okay? And a lot of patients are surprised they cannot even feel the positioning of their toes or their fingers. You'll see when you come here. Okay? And there's a lot of blood tests that will be required to do, okay, which give you an overall assessment of the entire body, because numbness and tingling, like we said, is associated with the entire body. It's not just a nerve. The CBC, red blood cell, white blood cell, glucose level, HbA1c, that's blood sugar level, if your iron level is high or not. We gotta assess your RA, NA, ESR, uric acid, homocysteine, to see if you have severe inflammation in regards to your muscle, toes, joints, and all that, and nerve system. Okay, electrolyte panel to see if your nutrition level is high, is good enough or not. Liver and kidney, we're gonna test the AST, ALT, BUN. Thyroid panel. Why thyroid? Because thyroid has a connection with every single receptor in the body cell, including the nerve cell. Okay, so we're gonna test your thyroid, T3, T4, TSH, TPO. Lipid, cholesterol level. Gonna see your hormone panels, cortisol level as well too. Okay, now the immune panel we talked about. All right, we just talked about it before in another slide. To be more specific, IgG, IgA, IgD. I think that naturally we gotta test also for tumor factor, interleukin 1 to 13, antithyroid, and these are all antibody. Okay, antibody to the smooth muscle, antibody to the mitochondria, antibody to the parietal cell. Not everybody had to do all these, but I will select the one that's appropriate for you to get tested on. Okay. If you have issue with the immune system, then for sure certain food will cause certain problem to your body, and that's how we do the food sensitivity test. If you need it, then we're going to have you do the wheat gluten autoimmune testing, gluten associated cross food reaction testing, multiple autoimmune reactivity, joint autoimmune reactivity screen. These are extremely sensitive tests to see if there is autoimmune with the food that you're eating. Okay. Also, we also offer patients to do a drop of blood. So we take a drop of the blood and put it under the microscope. We can see if your blood is normal or not. If your blood is healthy blood, is your red blood cell healthy like this, or is your red blood your cell clumped up like this? Okay, like we said, if the cell is clumped up like this, there'll be no oxygen, there'll be no nutrient exchange. Okay, your circulation is bad. Okay, we want to see if there's uric acid crystal, cholesterol level in your blood, and this is infection. If you have bacterial infection, viral infection, mold infection, it's all going to show up in the blood as well too. Parasite infection as well too. Okay, so there's a way to test for stool test, there's a way to do blood test, there's a way to do the live blood as well. So there's a lot of different ways that we can help patients to kind of find out what exactly is the cause. Okay. And other than MRI, the X-ray, we also have we call a surface electromyogram, where we test for patient's spine. Now, different coloration. If the spine color shows all red, that means you have some kind of muscle spasm. You have some kind of nerve disruption at that particular level of the spine. Okay, so this is how it is done. You change your gowns. We do, spinal scan one at a time. This is very good test. Having gone through all the different causes of peripheral neuropathy, all the different testing procedure for neuropathy. Once you come in and we did all those examinations and we found out exactly what's causing it, which nerve is causing a problem, which structure is causing a problem, what other factor might be causing all these neuropathy, numbness, hands and feet, then patient is going to ask me, so what are you going to do for me? What kind of treatment are you offering? Now this is the treatment that we do for patient. Let me read off one by one for you. Okay, we do K laser or corneal laser, pulse electromagnetic field, infrared, infrared treatment, ultrasound, rapid release techniques system, Orthostem, Russian stimulation, interferential stimulation, rebuilder neuropathy, Rife system, DRX 9000 spinal decompression. We do wave vibration exercise treatment. We do spinal adjustment. We give you oxygen therapy. We do acupuncture point stimulation with lasers or with points. We do neurofeedback to increase the brain activity. We give you the appropriate supplement. Herbs, homeopathic, is a treatment, okay, to improve your whole body system. Okay, we give you home exercises. We help you change your lifestyle. We help you change your dietary changes. We tell you exactly what you should and should not eat. We help you with the emotion. It's called neuroemotion technique, where we help you release some of the unwanted emotion, unwanted stress, which causes more stress to a nerve. We also do NAET, food sensitivity testing and treatment, where we help you take away the sensitivity of the certain food, so that certain food will no longer be affected your nerve. Okay, I will do some video to introduce you to some of the equipment that we do. Okay, just remember that these are all the stuff that we do for patient. Okay, if you have any question on any machine that we do, please Google these. Pause the screen and Google every single item that we do for patient. You're going to find tons and tons of information on every single treatment method or equipment that we use for patient. Okay, this is very extensive treatment for patient. There are a lot of different treatment options for numbness of hands and feet, peripheral neuropathy. I have just listed all the different kind of machines and technique and instruments that we use to treat. Now I'm going to show you each individual instrument and how they relate to your healing of the peripheral neuropathy, of the numbness, tingling in the hands and the feet. Okay. Now before I do all that, when patient comes in, I always look at the MRI, X-ray, blood tests, nerve tests. Okay, give me all range of information, but I also look at their pulse. Now this is a traditional 5,000-year history of Chinese medicine, where the Chinese people, we use pulsing system to see what's going on within the body. Okay, it gives us a very internal look aspect of our inner issues. Okay, so for example, if I test the pulse, I can tell if the nerve, there's inflammation in the nerve, if there's too much sugar in the nerve, if there's any infection in the nerve as well too. I can tell if the brainwave is, off. It's whether a beta, alpha, theta brainwave is off, affecting the hands and feet numbness. I can also tell if there is any organ issue that may have attribute to the injury of the nerve. I may also look at there may be certain food allergen that may have caused the nerve to be off and causing numbness, tingling. Okay, so whatever I find, then I can utilize different machine to solve that particular issue. For example, usually the very first visit that patient comes in for neuropathy treatment, the very first layer, we talked about layer, remember at the beginning, okay? For the very first layer of issue is usually inflammation. Usually, not every time, but most of the time. Now, if there is inflammation, then we use different machine. Okay, then we use laser. For example, I'll show you this one. If there is inflammation, then we use something we call K laser. You look at this. Okay. Now K laser, we shine this laser on the nerve system. Now I'll show you a model. If there is inflammation on the nerve here, then we use the K laser to shine on the nerve system. It will reduce inflammation. If the nerve is compressed by the spine, and the spine is offsetted by the tear of the disc or the tear of the muscles, then we can use laser to shine on the muscle, tendon, ligament, or the disc to repair the healing, okay? To repair the damage of the muscle, tendon, and ligament. Now, K laser is extremely effective, high power laser which heals wounds very, very fast. Also heals fracture very, very fast as well too. Okay. Now, if patient has numbness and tingling of the hands, let's just say another layer is the bone that's shifted. When the bone shifted, it could also cause compression of the nerve. It could cause some numbness in the hands. So what I do is I will, find out which segment of the spine is off. Then I use this adjuster to tap on particular segment of the spine. Then the spine will be moved to a correct place. Then the nerve hinge is open up, and the nerve start flowing, and the healing of the nerve starts, and numbness will be less as well too, if that is a layer. Okay. Now, if there is a layer issue with the scar tissue forming around the joint, causing further compression on the nerve, then we use something called vibration, high power vibration. Then we vibrate it on the spine, okay, around the scar tissue to open up the scar tissue, to break out the scar tissue around the spine. When the scar tissue is gone, the nerve becomes released and nerve flows better. Okay. Now, whenever we use machine, I always incorporate the use of supplements, herbs, homeopathic medicines along together with the machine to get best effect. Okay, so when you come in for treatment, you get the treatment here in the clinic. But when you go home, there's no treatment. So we gotta give you supplements. For example, if there's inflammation, I'll give you supplement for inflammation. I would take out from this test kit to see which supplement or herbs is best for you to take with the inflammation. Okay, if there is an issue with the tear, then we're gonna find out certain supplement or herbs that will help you heal the tear, even if you're not in the clinic for treatment. So you're healing throughout 24 hours, 7 days a week, healing along together with the supplementations as well too. Okay. Now there are other treatment in other rooms which I'm going to continue to show you. The next treatment we have offered for peripheral neuropathy is a machine called PEMF, which is called pulse electromagnetic field. When the nerve of the system, especially the hands and the feet, when there's a lot of tingling, numbness, you can't feel the wall, you can't feel the carpet, you can't feel the shoes. A lot of times it's because your nerve has been disrupted by other dirty electricity, by other dirty energy, by too much cell phone sometimes, by too much Wi-Fi signals. And when that bad signals come into our brain, it starts to give off bad energy into our nerve system. The nerves start to feel numb because too much garbage within the nerve system. And what this electromagnetic field pulse does is to clear out all the unnecessary garbage within the nervous system. Therefore, when the nerve is clear of all these garbage, bad energies, then the nerve becomes healed. Now, I have this one particular case with this man, overweight, severe numbness of the feet. He couldn't feel the carpet when he walked on the floor. I couldn't feel the shoes. So I use this. So what I do is I put these 2 pads on his feet, step on it, and then we do about half an hour to an hour of treatment. Okay, and then within few visits, he feel improvement. He can feel the carpet, the feeling is coming back. Okay, so this machine is really, really amazing, incredible piece of machine. Okay. The next machine that we are going to introduce you is the 3 things. So let me use a case again. If a patient comes in that has tingling and numbness in the feet and can't feel the ground and inflammation occurs, then we can use Rife system to clear the inflammation. We can use laser to clear inflammation. we can use we call stimulation, high volt, to clear inflammation. Your patient comes in with severe swelling of the joints, accompanied with tingling sensation of the hands. Okay, because accumulation of water, the edema comes from where? If there is damage in the wrist, if the damage has broken vessels, the capillaries are broken, the water leaks out of the capillary and sink into the joint, into the mass, the connective tissue, the muscle, the tendon, the ligament, therefore compressing on the nerve much more. Okay, so that's why whenever there is a swollen hands and feet, always patient have pain or tingling or numbness. Now, if there's inflammation, we gotta clear the water out of the joint. So we can we'll go to right. We set the setting to fluid retention. That means we take away the fluid. We set the laser system to clear fluid. We also set the stimulation to Russian stimulation, and we treat all at the same time. Okay. So the difference of our clinic is, first of all, different machines. Now, other clinics do not have laser. Other clinics do not have Rive system. Other clinics do not have K laser. Other clinics most of them have this kind of machine. But then again, most of other clinics, this machine are very, very old. Do not have these options right here. Okay. Now, another difference of the clinic here is that when we treat a patient, we treat patient for a long time, half an hour to an hour. Usually at the beginning, when you come for treatment with tingling, peripheral neuropathy, we spend an entire hour with 3 machines. So other clinic, for example, if you go there, they do ultrasound, they do stimulation for 15 minutes, then you do another exercise for another 15 minutes, then you go home, right? But different. What we do different is that we put all 3 systems together in 1 hour. 1 hour of laser, 1 hour of Rive, 1 hour of stimulation, all at the same time. Okay. Now think about this. If you do 15 minutes of stimulation and you go home, and we do 1 hour. We do 1 hour of this, 1 hour of this, 1 hour of this. So it's total 3 hours, right? But if you combine them together, we kind of concentrate into 1 hour. So the effect and the speed of recovery for you, it's much faster. It's much more potent compared to the other places that you go. Okay, that is the huge advantage in treatment here in our clinic as well too. Now, sometimes for the nerve damage needs nutrient, right? It needs oxygen. It needs our blood to be running around, running faster. Circulation needs to be going. Okay, if we notice that patients have low oxygen level in the blood, then we have another oxygen concentrator that can help you, increase your oxygen level, increase your healing level as well too. The next particular treatment we have for peripheral neuropathy is called Hyphomat. Now, this particular machine here, it's really great for issue when there is a lymphatic drainage issue. Now think about lymphatic system. Lymphatic system is kind of like a water piping system in our house. If the pipe system and under the ground in our house does not work, the toilet doesn't drain, the sink does not drain, the bathtub doesn't drain, everything just clogged up, right? All the dirty water just cannot go. So if we do not clear the pipe, the water doesn't comes out. So the function of this machine, the Hyphomat, is to clear all the piping system in the body. So once your piping system starts working, everything works better. Just for example, if your lymphatic system doesn't work, the piping system doesn't work, right? If the piping system in the hand is stuck, the wrist is gonna be swollen. The ankle is gonna be swollen. The whole body is gonna be swollen because your lymphatic drainage is not moving. So what this does is, if we run this on your wrist, on your feet, on your ankle, on your body, it's going to open up all the lymphatic channel. It's going to help your lymphatic system to drain all the dirty stuff out of your system, out of your muscle, out of your nerve, out of your system. Okay. Therefore, when the dirty stuff is out, then your nerves start to flow better. Then your numbness, tingling of the hands, it's better. Healing goes very, very fast. The next machine that we have offered here is we call a spinal decompression, DRX 9000. Now this equipment, it's an amazing equipment. It costs, the cost of this machine is like the cost of a house. Okay. Now the only thing that this machine can do is to basically shrink the disc herniation. If your numbness of the hands and not tingling of the feet is caused by a herniation issue, let's just say hands are numb a few years, and you did MRI, right? MRI shows that you have a bulging disc at C5, C6, which is causing nerve compression all the way to your arms and hands. Okay, and doctors say you need surgery. And you have did shots, you have did cortisone, you have did medication, you've been to several doctors and nothing else worked at all, and you're ready to give up. And you have no hope, no faith in anybody. But this machine, it's amazing. Now, I do not want to guarantee that it's going to work, but almost 90 to 95% of all the patients that comes in for the treatment, particularly with this machine, combined with the other therapies that I show you, 90 to 95% of all the patients, they get healed. I'm talking about their hands, feet, or numbness are gone, they become normal, they can feel things again, okay, they can start eating, they can use their hands and wrists, they can walk, and they can perform normal activity. They can, perform like a normal person. Okay. The only patient that does not get better is the one that do not listen. If I tell them to do certain food, if I tell them to off certain food, if I tell them to do certain supplements and herbs, they don't listen, then they don't get better. Or if they come in for one treatment, two treatment, they don't feel any improvement, they leave. Because think about this, if you have issue for 2-3 years, do you expect anyone to get you better within 1 or 2 visits? There's no way. There is no miracle. There is no miracle. Anything you do, you have to work at it. If you want to accomplish certain things, you have to work at it. If you want to get a degree, you got to spend time to study. If you want to make money, you got to learn how to make money, right? If you want to learn how to fix car, you got to take courses. You got to go to a mechanic shop to learn how to fix car. Everything takes time. Nothing is immediate. If you're looking for immediate one-time treatment and the symptom completely gone, sorry, this is not the right place. If you want me to fix you, you gotta be patient. Patient takes time, and when if you have the patience and hope and faith, you are going to get better. There's not a person that we cannot treat. Not a person. Okay, so if you go through the entire program, including the machine we talk about, you are going to get better. Okay, so what this machine does is going to open up your joint. Open up your joint so the herniation starts to shrink. When the herniated disc shrink, the nerve is released. The numbness at the feet, numbness at the hands, they're gone. They're gone permanently. They're not just gone for a few weeks, a few months. No, they're gone permanently. And once the symptom is gone, I will teach you how to preserve, how to maintain so it doesn't come back. Okay, just like when you go to a dentist, right? They took the teeth out. If they took it out, put in a brand new teeth, if you don't brush your teeth, if you don't eat right, cavity comes back again, right? Same thing with the spine. When your spine is healed, if you don't take care of it, you are going to get the pain back again. So you gotta know how to take care of your body, and I will teach you exactly how to take care of it. The next machine that we're going to show you in regard to treatment of the peripheral neuropathy is we call it neurofeedback. Now, whenever we treat a patient, like we said, in layers, if we found out the layer that your numbness in the hands and feet is caused by the brain, how do we know? Well, first of all, patient, they have already gone through physical therapy, they have gone through the treatment of the hands and feet, they have treated their neck and the back and not getting better. We have a lot of patients like that when they come in, and they have gone through all kind of therapy, all kind of doctor, it doesn't work. Okay, they got done traction, nothing, absolutely nothing work. And when they come in, I check their brain. So how do I check? So what I do is, first of all, I put electrodes. I put electrodes on their brain, Okay, and then the electrode would scan through the entire brain and then find out if there's any signal in the brain that is not working. For example, there's different parts of the brain that we can measure: the frontal, the parietal, temporal, occipital. If, for example, if we measure the entire brain, we found out that temporal region of the brain has issue in regard with low in beta wave. Okay, the machine will pick it up. Then once the machine pick it up, it's going to show us a graph. That particular graph may be very messy, maybe very low. It's not normal. Then once we found out that that particular graph is not normal, then I can tell that